everyone, it's Veronica, Behavioral Health Director for San Bernardino County, and this is our second video of our CBO meeting. First, let me just say Happy National Social Worker Month. The month of March is a time when we acknowledge all the social workers who work within our communities, and know that the theme this year is social workers are essential. I want to give you a COVID update. So as of March 17th, next week, St. Patrick's Day, the County of San Bernardino will be moving into the red. What that means is that our case rate has dropped sufficiently and we are going to be opening up other businesses. So that's good news. So the county is beginning to address telework. And so within the next few months, each department is going to be looking internally to see how they can bring staff back safely and continue to meet the business need. So DBH will be doing the same. For the moment, though, we are staying at our current telecommuting level. Also, we have our vaccination clinics. You all should have received the advisement that we had last week. Last Friday, we gave 147 vaccinations out, which is great. We also have a clinic that's open this week on Thursday the 11th and Friday the 12th. And we have already sent you the link, so please share that with anyone who is eligible, who is part of your staff, so eligible in 1A for healthcare, or they are 65 years of age or older. Please consider your patients, in particular for our residential treatment folks, our SUD folks. If you have clients who are 65 years of age or older, they're already eligible, and we encourage you to bring them in to help them register and bring them in so they can get vaccinated as well. We know that we've already have our orders put in for the Johnson & Johnson 1-dose vaccine, and we should be getting that in the coming weeks. Today I'll be testifying for the Assembly Budget Subcommittee, which is also meeting with the Assembly Health Committee. I'm going to be testifying specifically about CalAIM. So the first part of CalAIM I'm going to address is the integration administratively of mental health and substance use disorder. That means we are asking for one contract, one external quality review organization audit, one state audit, one administrative track for behavioral health. Also, I'm going to be speaking to the organized delivery system to remove the artificial restrictions we have on residential treatment. 30, 60, 90 days are just amounts of time that were pulled out of the air, mostly to meet a fiscal requirement. But as all of you know, there is no specific timeline on someone's recovery. Also, I did want to let you know about Senator Scott Wiener. He represents aspects of San Mateo and San Francisco. Now, Senator Wiener has met with our County Behavioral Health Directors Association, and he's really very open. He has had some of his legislation passed that are addressing parity, so he is a champion of mental health and substance use disorder. He does have a bill, Senate Bill 519, that we'd like you to look at, because there are some things that are concerning. And this is for the decriminalization of possession and personal use of psychedelics. Specifically, his ledge calls out psilocybin, which are mushrooms, MDMA, LSD, ketamine, DMT, dimethyltryptamine, mescaline, and ibogaine. Now, of all of those, we're very concerned about ketamine and being possibly used as for other purposes, including date rape. But ibogaine is the one that he actually spoke to us about. And for those of you in SUD, you know that ibogaine can be used as a way to help someone withdraw from opioids. It's not FDA approved in the United States, and we do know of many folks who do go to Mexico and other countries so they can get the ibogaine. It allows them to detox, but they don't have a memory of it. But during that detox period, they are psychotic. So there is that. And so the jury is still out, but that's what he presented to us. And when we looked at the bill, there are these other concerning things. So just wanted to put it on your radar. That's Senate Bill 519. We also are beginning our conversations with our managed care plans. So Inland Empire Health Plan and Molina Health Plan on ECM, the Enhanced Care Management, and ILOS in lieu of services. So as CalAIM moves forward, our managed care plans are able to get an additional funding stream to add these services. And many of these services are services that we currently provide via contract with you as well. So we're going to begin talking to them so that we can get perhaps the contract, so we can have an MOU with our managed care plans, continue to provide these services, which will then allow us to get the additional funding for those services, which will free up our current realignment and MHSA dollars, as well as our block grant dollars. And then finally, I just want to let you know we're coming up on some very important deadlines. So Assembly Bill 1976, which is an opt-out of Laura's Law, that deadline is looming. We have to have a board resolution by May 1st. We're at this point scheduled to possibly go to the board with our resolution to opt out of Laura's Law on April 9th, as long as we meet all those deadlines. And that also requires me to do board briefings. So we will be doing that. And that is simply because we already have a very robust system of care. And adding Laura's Law would be a redundant system that we would place that has no funding behind it. And the opportunity to opt out of 1976 is fully supported by our law and justice partners as well. And then I will be getting back to the Department of State Hospitals regarding the felony incompetent to stand trial program that they're calling Community Care Demonstration Project, which would allocate $233.2 million to counties from the state general fund for fiscal year 21-22 and $136.4 million for fiscal year 22-23. Those dollars would come to counties, and we would receive all of the incompetent to stand trial folks who are in state hospital currently, as well as on the waiting list. That's 1,700 deep, the waiting list. Once those individuals are returned to the county that they came from, we are then responsible for all of their care. And so those dollars sound like a lot, but the dollars then come out to about $108,000 to provide all care, including housing. And there's some of those folks also have additional issues, such as being sex offenders, arsonists, people who have very complex behavioral health and physical health care needs, with the caveat that if they did need to be returned to state hospital because they were just too ill, that we would pay a premium of 150% of the current bed rate for state hospitals. So for those reasons and a whole lot of others, we are not possibly going to opt into this. Certainly our County Behavioral Health Directors Association is very concerned, as is the Legislative Analyst's Office. And so we'll give you more information on that, but those deadlines are coming up here in this month. So that's all I have for you for this update. I look forward to seeing you all in a couple weeks on our live WebEx version. And until then, catch you on the wild side.